So as we were then going on, and I was checking on my AI and my Chat GPT, and under the umbrella on the Maui Beach in Kaanapali, I scrolled down to see what the other considerations were in terms of demand. What were the cosmetic surgery breast demands? And a close second coming in was cosmetic breast surgery. Now that's kind of changing, and that's interesting, and I've really have seen that change in the last 12 months. And what we're finding now is that I'm finding that more patients are calling our office who are interested in breast lifts. It's interesting that before, let's just say 2 years ago, 3 years ago, that most of the phone calls were for breast enhancement or enlargement, breast augmentation. But now I'm going to say that we're probably getting 85% of our phone calls are for breast lifts. Sometimes the majority of the patients, they just want their breast lifted. There is, of that other portion of people who call us, they will be calling us because they want a reduction in size. Maybe they're large, and then we always want what we don't have, right? So it's going to be the woman who's too overly endowed and they want to be smaller, so they want a reduction and they know they'll need a lift with that. Or maybe we've had a patient who had breast augmentation with implants many years ago, and she loved having them be large back then, but now she's out 10 years, 15 years later, and she's tired of carrying around the larger breast mass, and she wants to be smaller, perkier. And as we get older, women will find that if they're a little bit smaller, it gives them a more youthful look. Absolutely. So what we are now doing is we're evaluating these patients. And so again, we do everything under local anesthesia in our office, but it can be a really nice procedure where we can go in under local anesthesia and do breast lifts for patients. And I will tell you that breast lift patients have, in my opinion, one of the highest cosmetic surgery satisfaction rates of all patients. Behind that, or equal to that, will be cosmetic breast augmentation. We'll talk about that in a minute, but breast lift patients love it. Now, the subset of patients that I like to take care of are the ones where they feel that the breast is hanging over their rib cage. I had one patient, she's really sweet, and she's sort of being a little self-effacing, and her comment to me was that she felt like her nipples or her areola were having a race down to her belly button. And that sounds kind of funny. Okay, she was making light of it, but you could feel her pain, all right? You could tell that this was really bothering her. And I remember once as a general surgeon, when I was a breast cancer surgeon, and I was part of the American Cancer Society here, the local chapter here in Sonoma County, and I was having a lunch meeting with one of the directors, a nice young lady, and we were just eating and having a nice lunch meeting talking about the American Cancer Society. And she was telling me, then related to me, that she had had a breast reduction and lift. And so I wasn't doing cosmetic surgery at that time. And there's a famous rock and roll saying, Bob Dylan penned it, and the Byrds sang it, and it was, "I was so much older then, I'm younger than that now. I was so much older then, I'm younger than that now." And really, what does that mean? It meant that when we're younger, we tend to be more judgmental. And if we have some self-reflection, some personal growth, a lot of times we'll look back and say, we were being a little judgmental back then. And it's interesting because although my career has evolved into cosmetic surgery, I wouldn't have guessed that when I was in my early 30s as a general vascular transplant surgeon. So I asked her a few more questions and asked her why she would want to do that. And her comment to me is, "You don't understand what it's like to be big, lying down, having your breasts roll off to the side of your chest, under your arm, or getting up and having to lift up this amount of tissue to put it in a bra. How uncomfortable it is, how it's hard to find clothes, and that this subset of patients suffers much from that negative self-image, if you will, and that they can really be helped quite a bit in terms of their self-perception with a breast reduction. And physically and medically, a lot of them will complain of back pain, shoulder pain from wearing bras, carrying the heavy load, if you will. And so by reducing the tissue and doing a lift, they're some of my happiest patients. And I am now seeing patients, of course, in their 30s after having babies, and they just want to lift. Sometimes they want to be larger or augmented in their 40s, certainly. But I'm seeing more and more patients now in their 50s and in their 60s who are doing this. And I think what they're doing and they're finding, and as they get older, that they're done with the haters, okay? They're done with the people who are trying to tell them always what to do. And I see Jeff, our program director over here, and he's a young guy, a handsome dude here over here, but he's shaking his head in agreement. There are a lot of haters in the world who are trying to tell us what to do. You shouldn't do this, or you should do this, or you should just be happy with this. They're trying to direct our lives. And now that these patients are a little bit older and they feel more comfortable with who they are, hey, I've always wanted to do this. This is gonna make me feel better. And they are some of the happiest patients I have, where we can do a breast lift, make them feel more youthful, make them feel less matronly, okay? And you may be sitting out there and saying, hey, what difference does it make? But when you're that patient, you live in their skin and you try to understand the pain they're going through, they can get great benefit from something as simple as a breast lift, and for those who need it, a reduction. So that's cosmetic breast lifts was, again, seems to be on the rise when I was checking out AI, ChatGPT, under the umbrella on the beaches of Kaanapali. So then right behind that was breast augmentation. And with breast augmentation, what the trend now is number one, is to be going smaller or looking for a more natural look. And I have to tell you that I love that. I love this new trend. And really, it's, in my opinion, also a safer long-term benefit for our patients. If you remember, I was talking about the breast lift patients, and that there was a subset of women who, when they were younger, they got augmented, and a lot of times ladies, and they're listening to their girlfriends, and they're saying, yeah, go bigger, you want to go big. And they go bigger, but 10, 15 years later, they're kind of tired of it, and they want to go smaller. So now we have newbies, if you will, who are interested in being augmented, and they're on the opposite spectrum. And so before we judge them, okay, again, you haters, just, you step aside, please. These are women who are flat-chested, or they feel that way, and they don't feel feminine. Again, you got to put yourself in their skin, all right, and see the shoes that they're walking in. And so they're flat-chested, but they want to be augmented. But they're feeling less pressure to be huge, to be really big. And so I think that's healthy, because with smaller implants, and we can make them look very natural that way, with smaller breast implants, we actually have less, I'm going to say, stretching of the skin, stretching of the chest wall. Therefore, I feel like you have less surgical problems afterwards. You're able to carry them longer. And I think that with this newer trend, the patients are going to be happier long term. And it's nice to see the younger generation have a little bit of foresight in terms of, and I'm hoping that's one of the reasons why, is that they can see that long term, that they're going to be happier for a longer period of time if they don't try to go too big. So natural breast augmentation look is in, and it's certainly something that, hey, I'm definitely interested in. We're known for trying to guide women in that direction anyways in our office. So if you're interested, please feel free to reach out to us. Our consultations are complimentary, and Karina, who should be with us today, who's our breast surgery liaison, is a wonderful young lady. If you give her a call, she can answer many, many questions.